My name is Heun, I'm a consultant psychiatrist, and in our series Mental Health Explained, I would like to talk about Wilson's disease. I would like to make two important points. One is that physical health problems can cause mental health problems, and that a physical examination makes sense in psychiatry. Wilson's disease is a rare genetic disorder which is caused by a recessive disorder or a recessive genetic disorder on chromosome 13. The ATP7B gene might have functional changes which might affect the production of the related protein, and this protein is normally functional in transporting copper out of the body, and it would usually be ATP, that means energy dependent. So it's ATP7B gene, which has a recessive genetic transmission, which means that you need just two faulty genes to get the disease. So you must have many more carriers in the population. Some people say it's 1 in 100, the carrier, and if you have the genes of two carriers which have faulty ATP7B genes will meet, then the disease, Wilson's disease, will start. Usually it starts in late adolescence or childhood, late adolescence, and sometimes it shortens the life, and people rarely get above their 60s if untreated. So it starts in childhood, early adulthood. The liver is affected due to the increased copper levels. There were extrapyramidal signs due to the affection of the basal ganglia, which include tremor, dystonia, increased muscle tone, flapping tremor of the wrist, which is a tremor which just goes up like this. So it's not a permanent tremor, it's just like flapping. And there are shoulder tremors. There's a very stiffness in rigor sardonicus in the face, so stiffness of the face. Dysphagia, dysarthria, which means unclear speech, and unclear whatever problems with eating. And the most important thing, which is easily to be seen, is a Kaiser-Fleischer ring, which is a green-brown corneal deposit in the cornea, which makes it important that people are examined properly. So psychiatric symptoms can be depression, mood disturbances, very common. It can be subcortical dementia in 25% of the population, and it can also cause psychosis. Right, so a mixture of mental health problems. So physical health examinations are in the bloods, and there are increased urine in the copper, increased copper in the urine, increased copper in the serum, and the ceruloplasmin in the body is reduced. It's treatable with copper catching or copper chelating agents like penicillamine or triantine, and there's some discussion about the effects of zinc. So in totally, this is a Wilson's disease, is a rare disorder, recessive genetic disorder, which might sometimes, quite rarely, come into mental health units, but very often can be seen in medical departments where the liaison psychiatrist is asked to help with the treatment of the mental health problems. Thanks for your interest.